Hello and welcome to CVR English. I'm Anukriti Govind Sharma, and today we have gathered at the CVR English news desk to discuss a very important topic. In fact, a topic that has been plaguing our country for months now. A topic that has managed to stay in the top headlines of all the major newspapers, hitting Hyderabad and Andhra Pradesh. Yes, ladies and gentlemen, my dear friends, this is the one and only COVID-19, the novel coronavirus, which has got the entire country in grips right now. Everybody is thinking about it. The virus is everywhere in thin air, and more cases are arising in our country with every passing hour. Every day, every morning, with every newspaper, we are coming up with more and more numbers of positively testing patients. What is to be done? We are living in times right now which are extremely stressful, and no doubt we are becoming more and more anxious about the coronavirus. The why, the how, and the where. There are so many questions which are arising in our minds, and to answer these questions, to relieve our queries and to release our anxiety to a certain level, we have somebody in our studio who is very special, somebody who is highly knowledgeable and acclaimed in this field, in this science. We have none other than Mr. Neehar Reddy, who is the CEO of Dr. C. So first of all, sir, I would like to welcome you to the CVR English News Desk. Thank you so much for taking out the time from your busy schedule to be here with us. So over to you, sir. Just let us know about what you do and what your company is about.
First, thank you so much for having me. It's great to be here today. So I am the CEO of Dr. C. We started Dr. C back in 2013. Me and my two business partners, we were software engineers. We went to the US for our masters, and then we moved out to California and working there for about 5 years. And over those 5 years, we really learned how technology impacts society, especially living in the Silicon Valley, which is the mecca of software. We really saw how tech companies worked and how you could use technology to really innovate and change an industry. So in about 2013, with the idea of starting a business, we moved back to India. My family comes from a healthcare background. Me and my co-founders, we came from a technology background, and that's kind of where Dr. C origin started. The primary motivation when we started was, how do you use technology, especially in Indian healthcare, to deliver better healthcare experiences, seamless healthcare experiences centered around customers. So customer-centric care. And that's what we started with. We started with a small apartment in Gachibowli. It was 4 of us. That's 6.5 years ago. Today we are present in 13 cities, 6 states. We have 200 people working with us. And it's been great to see how Indian healthcare and Indian consumers have adopted technology. Not just in this industry, but you can see people going online with food, transport, travel, and people are coming online for health. And the Indian consumer has become more health empowered.
Absolutely. And technology is being used in almost every sector of life, like you say.
Absolutely. And with the prevalence of smartphones and the wide availability of data, people are more empowered today than they were, let's say, 10 years ago.
Absolutely. More access to knowledge, more access to technology, and that's really helping them to reach out and get better access to healthcare. Again, with the help of technology, like you say. So if I may ask you, what does the C in Dr. C stand for?
The C stands for customer.
Lovely. All for the customers. That is absolutely great. So just correct me if I'm wrong, sir. Because you specified on the word technology, I believe that technology is being used for healthcare by you. So is there a scope for biotechnology anywhere, the conversion of biology and technology together to deliver better healthcare to the customers?
I think that's absolutely happening in the world today. That's not what we do at Dr. C, but if you look at how technology firms have started innovating in biotech, you can see progress all around the world. The Bay Area has been central for tech, but a lot of investment now from the Bay Area has started moving into biotech as a space. And more interesting things have been coming up. If you look at TED and look at the kind of progress that's coming on talks given by people on the progress being in biotech, I think that is happening. We are going into a world that we couldn't have imagined. and every day it's a surprise for me. It's a learning experience.
Absolutely. For all you scientists out there, it's a learning experience every day with newer and newer technology coming out into the market. And so many different scientific fields are also merging together to create new sciences altogether. Combined sciences, applied sciences instead of pure sciences anymore. So, sir, if we come back to the current scenario which is plaguing our country, and not just our country, it has become a global health crisis now. The invasion of the coronavirus all the way from China, Wuhan. Now, if we talk specifically about our country, and we see so many new cases arising in our country with every passing day. Right now, I've heard that we have got approximately 128 positively tested patients of coronavirus. Yesterday, it was just 114. Today, suddenly it becomes 128. Tomorrow, we can't even imagine the number. So, out of all the people who are being plagued or who are being tested positive for the coronavirus, which group of people in our society is the most vulnerable right now, according to you and your studies?
Sure. So the people who are at the highest risk today, I think there are about 2 or 3 sets. One is people who are older.
Okay.
And we are seeing that this has been corroborated by the CDC, by the WHO. What you can see is that people above 60 are at higher risk for getting coronavirus. And people who are above 80 are at the highest risk.
Highest risk, above
highest
80.
risk, above 80. So these are the people that have 2 kinds of issues. One, it's easier to get the infection. 2, after you get the infection, you have more complications. So it's a 2-sided impact for them. So it's very important that we are more careful with the elders in our house. This could be your grandparents, parents,
Right.
whoever. And a lot of the time, it is important that they are educated at least to a basic extent to understand how they need to keep themselves safe as well.
Right.
The second segment that's really at risk is people who have some sort of chronic condition. So this is people suffering from diabetes, heart disease, lung disease, respiratory diseases.
Already suffering from some disease condition or the other.
Yes. Even for them, they're at a higher risk and complication rates are higher. The third set is people who have lower immunity. So these are people I see a bunch of them in my own office.
Right.
People who tend to fall sick easily. Right? They have fevers, colds,
They'll
coughs.
keep catching flu very occasionally
Yes.
compared to the other people.
Yes.
Even I know such people. Yes.
So these are the people who are at higher risk, and they need to really be watchful, especially in this environment of contracting the disease if they're not careful.
Especially, we can also say that the older generation, like the people above 60 and above 80, like you mentioned, even these are the people who are already suffering from a suppressed immunity,
Yes.
primarily because of their age, if I may say.
Yes.
So what can we do, what measures can be taken to safeguard these people specifically out of this entire lot of people who is suffering right now? This special group above 60 and above 80, how can we as people around them safeguard them and make them more aware so that they can safeguard themselves if there is nobody around?
Yeah. Step 1 is just education. They need to understand what it is and how it harms them. So for understanding what is coronavirus and how it spreads, right? So the basic way that coronavirus spreads is by going through water droplets. That when a person who is infected, when they're speaking or sneezing or coughing, there's some water droplets that leave your mouth, and they can fall on someone directly or indirectly.
Right.
Directly is I've coughed without putting my hand in front of me and something has fallen on you.
True.
If I have coronavirus, there's a chance that you can contract it. There's also an indirect way you can contract it. Let's say I cough and my cough fell on a table. Now I went away, 10 minutes later someone else has come and touched the table and then touched their face. Now there's a lot of talk in the media of don't touch your face, don't do this.
Right.
Most people don't seem to understand it.
We are constantly bombarded with this information these days.
Right. And I can see it as someone who touches my face a lot because it's
So do
instinctive. It's instinctive, right? We want
Even
to
as we speak.
Correct. We want to comb our hair. We want to.
I just did this.
Yes, that right. You want to move blow your nose. You want to rub your eyes. You want to clean your mouth. We touch our face a lot, more times than we can count. Now, even my wife keeps shouting at me saying, "Stop touching your face," especially right now. The reason is this, right? It is because when someone touches a commonly used surface, and this is a very scary term, commonly used surface, because let me give you a few examples. You went out, there's an elevator, you press the button.
True.
The button is a commonly used surface. You went out, there's a door handle, everyone opens the door. You're at an office, you're outside, everyone opens the door. You don't know who's touched the door before you. Then others say everywhere you go you have to sit, everywhere there is a table. So all of these are points that are commonly used that can infect you. And that is why it is very important that people understand that this is transmitting, because someone has sneezed, coughed, or some saliva has fallen directly on you or on a common surface.
Or on a surface, yeah.
And then you touch the same surface and then touch your face.
Absolutely.
So we need to educate our elderly that this is why it is happening. It comes through saliva, and we want to avoid that as much. So once they understand that, the most common way we can guard ourselves is to wash our hands.
Absolutely.
Right?
Just like you mentioned, we have a tendency of touching so many public surfaces and then touching ourselves. So when we speak about washing our hands, I'm so happy that you brought that topic up, because I wanted to really ask you, this is a question which is bothering me as well, so I'll take it rather personally. We are constantly being told that the common soap lying at our homes is far more effective than the so-called expensive sanitizers which are available right now. How much truth is there in this statement, sir?
From everything I've read, I think the best way to do it is common soap. Right?
So something as common as soap is probably the best strategy against the virus right now?
Yes.
And how does it work, sir?
The virus?
No, the soap against the virus.
The basic idea is simple, right? You are touching something, you want to disinfect your hand.
Yes.
The soap itself disinfects your hand by using it. Now, the important thing here is how you wash your hands.
Okay.
Now, one of the things that we've taught in our office and we've taught people is how do you wash your hands. Now here, typically this is how we wash our hands. It's a very light rub on both ways. But if you actually see, there are surfaces in your fingers.
Yes,
there are
you're
surfaces in
so
the
many
center
crevices, so many folds in the skin.
Yes, there's your wrist. We always miss the wrist, right? So there are now videos on YouTube which show you how to wash your hands.
So there is a correct technique of washing hands as well.
Yes, and it is a simple technique. It will take 30 seconds, unlike the past where we might spend 10 seconds, we'll have to spend 30 seconds to wash our hands.
Absolutely.
But I think if you Google how to wash your hands, that's the first result
We'll get
today.
the technique right there.
Right, so get the technique, teach people in your house how to wash their hands.
And because you have a company by the name of Dr. C, I believe that doctors, especially when they are interns and they're about to become young doctors, even they are taught the correct technique of washing hands. I believe they have about 6 or 7 steps where they have to wash each and every crevice also. That's very interesting.
This is commonly, if you ever go into a diagnostic center or a hospital, you can see in the bathrooms they actually have posters stuck
Yes, yes.
And it's become more exaggerated now because it is a requirement that everyone understands.
Absolutely.
So first, educate them, right? The second thing that you can do after you educate them is to make sure that when someone else is entering your house, you get them to wash their hands as well.
Very important.
Right, and this is common. There are a lot of people who enter our homes on a daily basis. This could be our drivers, our maids, any help around the house.
Even a guest.
Even a guest, right? We want to make sure that we educate and ask people. This is not insulting. It's not meant to be insulting. We are in a time where it is required.
Yes, safeguarding them as well as ourselves.
And so once we have people wash their hands, I also extend this to, let's say you're getting a Swiggy or Zomato order delivered.
Right.
When you pick up the order and go back and wash your hands before you
Yes,
eat.
yes. Again, it's a surface which has been previously touched by so many people at the restaurant.
Everyone in the kitchen to the delivery person all the way to your house, right? And you want to make sure you wash your hands, and that's the safest way. I never thought about
it really. I'm sure the viewers have also never thought about it earlier.
These are the simple things that we miss that put us at danger. Points. Right?
Very true.
I think these are the basic things that we want people to do. Obviously, adding to this, don't go to a crowded place. Avoid crowded spaces. That's why the government has shut down the malls. Schools have been shut down till the 31st. And avoid travel unless you really must. There are a lot of other people on trains, buses and planes. We don't know where they have been. We don't know what they have been exposed to. So the best thing we can do is stay at home or stay in a place that you know is safe.
Absolutely.
Right? And the second thing that adds is people who are infected don't show symptoms till almost 14 days. Incubation can be about 14 days.
Oh.
And you can have people who are non-symptomatic carriers. That means you will not have a symptom, but you can transmit the disease.
So could that happen because I have a stronger immunity and the virus is not powerful enough to create symptoms in me, but I can still be a carrier?
So that's still being studied. It's still being understood why it affects people and why it doesn't affect some people. But it's clear that there are cases where it can transmit from a person showing no symptoms to someone else.
Just being a silent carrier like that. I did not know about that. In fact, sir, the newspapers are not writing about this aspect of the coronavirus at all.
I would highly encourage reading more. There are published sources like WHO. There's a lot of
Right.
stuff that's going on with CDC.
Authentic sources online which are writing about
read
this.
what our newspapers are writing. Read what the world's best organizations which are tackling this problem are
The
writing.
medical officials from there who are writing.
Yes, and I think to be well read is one of the best defense you can have right now.
Just like you said, making people more and more aware about it, especially our elderly people at homes. If they are more aware, they can safeguard themselves better.
There's another big point with elderly people. So
Okay.
elderly people and people suffering from chronic conditions do a lot of medical testing, like your basic sugar test, cholesterol test,
Right.
to keep track of their health.
Okay.
Now, even in that specific scenario, it's very important that they're careful. That means that today there are services available where you can do tests at home. So you
Right.
can do your blood tests at home. So you can have these services. Dr. C provides these services as well. There are plenty of other facilities as well which provide these services. So if you start doing your testing at home, it's safer for you. You will not get infected by what's going on outside.
Very true. Just
And
like
if-
you mentioned.
And if you're infected, you're not going to transmit it to other people.
Very true.
When you're doing it at home, there's a second thing that you should be careful of. If the person who's coming home, the medical paramedic who is coming home to do your testing, they need to follow proper protocol as well.
Okay.
By that I mean 4 things. One, they need to wear an N95 mask. The
N95 mask.
N95
Sir, if I may
mask.
interrupt you, what do you mean by an N95 mask?
N95 mask is a specific mask which has a filter on it which helps people who are especially medical workers who
Okay.
are traveling a lot to maintain some amount of hygiene which they are not infecting with you.
Okay.
Even for you when you're going to a crowded place, it is better that you wear an N95 mask, especially for people who are infected. It is the best way not to spread it.
Okay.
So if you wear an N95 mask, you know that you have coronavirus or you're showing symptoms. It is best that you have a mask while you are talking and getting the necessary help so you don't infect others.
Okay.
Right? So first you
That
want
is the N95 mask.
N95
First
mask,
condition.
first. Second, when they come in, you want to make sure they use alcohol rub to sterilize their hands.
Right.
Right, that's important. And the
Again, they also need to sterilize
they need to
their
do it with the
hands.
same technique.
Right.
Then they wear gloves, and this is important. They should ideally there should not be any skin contact between you and the paramedic.
And the person, yeah.
So they were going to wear gloves.
Okay.
And after that they do the collection. So
Okay.
even after they do the collection, it's important that they dispose the medical waste appropriately. The waste should not be left at your house.
Very true.
So the syringe or the needle, the cotton, all of that should be disposed correctly following the proper protocols. Now this is important for people to do safe testing. This is safe testing in their own homes by safe medical professionals.
So it is very safe, like you say. And speaking of safety, yes, we are assured that it is highly safe. And like you mentioned, that the elderly people should try to avoid unnecessary travel as much as possible. This will just help them to avoid further complications with their health.
Yes.
So they can stay at home and we can have medical officials visiting them and testing them. It is very safe. How effective is it, sir? Is it as effective as going to a proper diagnostic center?
See, your basic blood test, if you look at your basic blood tests, they're all done at using the same equipment in the
Yes.
same labs. The only thing that changes is where you get the test.
Okay.
Today, if you see what is possible with better technology, better logistics,
Right.
lot of things have started coming home. First, food came home. Then you started to see other things come home.
Yes.
You started to see medicines come home.
Amazon,
Right.
online shopping.
And this is what is happening. The world is coming to you, and
Absolutely.
especially in India, all of us as Indians like things being brought to us.
Yes.
And health is also being brought to you
Very true.
on your terms.
Very true.
What is important here is that the safety protocol be maintained, and
Right.
that's where the healthcare providers have to maintain the highest quality, and that's
True.
where technology plays a big role.
Very true.
In make sure the correct protocols are in place, are they being
Yes.
followed. That's where technology plays a big role.
And that is where your company comes into the picture, because you have the best technology to make sure that the healthcare providers who are visiting these elderly people at home have the best technology to offer to them.
Yes.
So that tests are conducted in the most effective manner. That is very
Absolutely.
nice. Sir, may I just ask you, we see so many school closures happening around us these days, and considering India, it's still a country where we see a lot of joint families living together. It's a country where more and more nuclear families are coming up, but we still have the joint family structure intact. So does this school closure scheme which has been put up by the government really help, or is it going to negatively affect the children and their families? Why should the children
Sure.
be asked to stay home when, like, doctors and people like you are constantly telling us that youngsters and children, usually for the most part, they do very well for themselves. Even if they get infected, they have stronger immunities. So why are the children being forced to sit at home?
So I have a two-part answer for this, and one was a conversation that I was recently having with my wife on the same thing.
Okay.
So there's some literature being published now which talks about how keeping students at home actually forces other people to stay at home, right? So it is a second order effect. So by having your children at home, you are not going out.
You're forced to stay at home because of your children.
So the second order effects. Now, if you talk about the first order effects of schools, there's a danger, and so it's good that it's better to be over cautious in this scenario than under
True,
cautious.
because
So-
it's a public gathering at the end of the day.
and you have teachers, you have older teachers, younger teachers.
very true, like you said.
And so I would say, in terms of closing of schools, I think it's better to be overcautious than underprepared.
Very true.
And second, the second order effects of that is it forces more people to stay within their home, which contains the spread of the disease.
Very
So I think in terms of that specific move, the first and the second order effects, in my view, are in the right direction.
True, just like you said, we can have older teachers at school also. So the children, they might get easily infected, but they may pass on the infection to a probably older teacher, or probably when the child comes home, there's a grandmother or a grandfather also, like you said, above 60, above 80 years of age. So the children could also become carriers in that case, just like you said.
Yeah, they're at lower risk and they have lower this thing, but could be carriers, right?
But they could transmit the infection to probably an older person who has a suppressed immunity.
Yeah, which is also one of the fears that I have when I talk to other people, even in our office, which is even our risk or our complication rate might be low, but we have other people we interact with in our lives, our family members, it could be a relative, who we can put at danger, even though the danger might not be very high to ourselves.
To ourselves.
Right?
Yes.
And that's what we don't want to do. We want to act as a society,
Right.
especially in this kind of a situation. We want to act as a society which curbs the growth of the virus, not
at large,
accelerates it.
and be more responsible towards each other. So sir, if we talk about the current status of the coronavirus in India, what are things looking like? Are things going to become worse in the near future before they get any better?
So the data that's available because of the limited testing in India actually makes that question very hard to answer. If you see how many people we are testing per million, we are testing 5 per million. You look at how many are being tested in other countries, we are seeing 5,000 per million. So the number of people being tested in India is very low. So we've only tested 6,000 cases so far. And if you see how many are being tested, it's 6,000. Who are being tested? These are primarily, the testing currently is being limited to people who have some sort of travel history.
Right.
Now, but when someone comes back from travel, they're moving around in the local community, right? So if someone infects someone in their community, those people are not being tested properly.
So those people are not being tested right now.
Yes.
That's news for us.
There is a problem that enough testing is not being done for people in the community. There is community transmission happening, and that needs to be tested.
The stage 3 transmission, which you call it. So only the stage 2.
So people who are having direct travel history are being tested. We need to widen that scope to anyone who's suspected of having that thing should be tested. And that's important because I actually believe there are a lot more undiagnosed cases today than we realize. And the way it's moving, if we are going to test at the rate at which it's growing is going to be faster than the rate at which we are testing, and that needs to change.
Very true then.
So we need to test more. That means today, for example, today's news was a step in the right direction. The government has already said that they're looking at private labs to kind of help with the testing. They've set up 52 hospitals and labs which are accredited for testing, but that's, given the size of India, that's nowhere near
Given
enough.
the size of the population which we carry right now, 52 private labs is not even a speck in the universe probably.
Yes.
So, sir, like you said, currently what the newspapers are propagating is the fact that India still has the coronavirus at stage 2, which means that only the cases which are coming back from the countries that are affected and the immediate people that they are in contact with. But like you said, because of the very limited nature of testing in our country right now, we are not really sure whether the stage 3 transmission of the disease has actually started or not. We are not aware of that because of the limited number of labs available. So I feel that the idea which you are propagating through your company works out really well in this scenario, where we can have more and more home testing taking place, with more and more medical officials visiting the people directly at homes, so that quick and instant testing can happen and we can move forward with that. Is that true?
Yeah, I would say step one is, I think, first have private testing available. Today, only the government certified 52 labs are allowed to do the test. So step one is get private testing in place. Whether this is you visiting a hospital, it's better than not getting tested. Second is extend that to the home. The ideal scenario, according to me, is that you are in your home, you're tested at your home. That way you contain the actual spread of the virus, right? So in the long term, I would say home-based testing would be the ideal scenario, but step one is to first get it to private testing, and then we can look at
exactly. So home-based testing is the ideal scenario and also the quickest way to get the tests done. So ladies and gentlemen, that was Mr. Neehar Reddy with us from Dr. C, and like sir has already told us, yes, home-based testing is the need of the hour because it is safe, it is effective, and it is very quick, and we as India require it to keep up with the spread of the novel coronavirus so that we can tackle the virus and beat it in its infancy. Thank you so much, sir, for joining us at the CVR English studio today. This discussion has been extremely informative, knowledgeable, not just for me but our viewers at CVR English. Hoping to meet you once again so that we can catch up and discuss more about this coronavirus, which we will do in the near future. But for now, it has been a very fruitful discussion.
Thank you so much for having me.
Sir. And for more news and updates on the novel coronavirus, stay tuned to CVR English.